in 1900, we had a bunch of midwives who were trained to deliver, blah, 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 blah. In 2006, we don't have the midwives, and they just closed a hospital in our area that did that. What's wrong with this picture? I live and work in the third largest African-American community outside of West Africa, and we don't have that service. So there is a disparity. Last comment, 3 weeks ago I was out on the West Coast. I was out at the Mayo Clinic. They had just conducted a week-long seminar on disparity in healthcare. Now, disparity is not only aimed at African American, but there are a lot of people around this country who don't get adequate health care. And I think that the recounting of the beds, my suggestion to you all, to the people who make decisions, is that the proposed closure of hospitals should be further studied.
Yeah, you know, I wonder, I have not read the Berger Commission report. I wanted to acknowledge that. But I wondered if they took into consideration housing and the fact that new housing is coming into an area. I'm wondering because, as you know, in New York we have these large housing developments. Like I just read just recently where Starrett City has over 12,000 people in it. You know, and of course the huge developments come up, and you need hospitals, you need schools, and you know. I wonder, did the Berger Commission take in consideration housing and the fact that additional housing is going to be built in an area?
Well, take for example preventive medicine.
Right.
All right. That's one of the key entities that we should be looking at. Preventive medicine saves us for a lot of problems. For an example, in our neighborhood is, say, cancer of the colon. All you got to do is to do a physical, not all, but what you can do is to have a physical examination once a year. And then you look around and you see that the patient now has a decrease in his hemoglobin. That's a key to say, look. And we look at the patient and find out where the what's going on. But you get the poor patient out there that doesn't have excess like this, then we got a problem. We have patients with hypertension. The pressure should always be about 120 systolically. And then we got a patient like yesterday. I had about 3 patients with blood pressures over 170. Now, you got to explain to them, education, why you want to keep your blood pressure down to 120. See, my motto, and all my good friends, is to put the dialysis unit out of business. I'm fortunate, or my patients are fortunate, and I played this since way back in medical school when they told me how to try to save patients' kidneys. I only have 3 patients that ever been on dialysis. That's all.
And all your years of practice. How many years?
All my years of practicing. To make money?
Well,
1976 to make money. But I've been hanging out with clinical medicine since 1958.
1958.
Right.
And you only had 3 patients.
Since I've been practicing medicine. Only 3 patients ever went to dialysis.
Right.
And it's all because you have to talk to the patient and convince them. And when they don't show up, have your staff to call and say, Miss Jones, when you want to make another appointment? Then Miss Jones will tell you, I lost my transportation, I couldn't get in, my knees were bad, or whatever it is, you got to stay on top of it.
Well, let me ask this question, Doc. What is wrong with our health system? I mean, you've indicated a few things here and there. What is really wrong with it?
Not understanding. And the point is that, as I started to say earlier this morning when we were coming down, there are a few things that have increased in health. One is the ICD book. That's where we got all the diagnoses and all the numbers. And you got to go through that book and find out the right number. If you put the wrong number down, the hospital or the doctor, then they come back and tell you owe me some money, and then they're going to take the money away. The next thing is the CPT code. Those are the procedures.
What's CPT code? What is that?
That's the procedures. If I take off your nose, there's a number in there that I have to put down. And that book gets bigger and bigger. The next thing is, obviously, is the cost. You see, we have patients with hypertension. They're living longer. It costs you more for that. When age comes up, there are a whole lot of things that we got to do, and it costs you. Take, for example, a diabetic. Got all the ulcers. The kidney goes. He's got to take medicine every day. He's got to have the equipment to check the sugar. Costs. And then you take, for example, a patient with cardiac disease. He's got to have somebody to take him across the street. Costs. Because you need the home attendant. Now, and cancer, a whole series of stuff. The chemo, what you call it. And the problem comes, how can you tell me that you're going to cut the costs, or use that qualified phrase, contain costs?
Well, let me ask you this.
When you got an increase in all these responsibilities.
All right. Now, I got the problem.
Okay.
You've made it very clear. There is a problem, and you indicated that. How do we fix it?
Well, you fix it like they're attempting to fix the Iraq war.
How's that?
You go and get yourself a committee, the right set of people, including practitioners and a few of them, and we sit down and look at every piece of health legislation, everything that we can do for Mr. and Mrs. Jones and little Junior and the little kids, and we see what we can do better for them. That's what we need. We need that committee like yesterday that's going to sit down and say we're going to analyze it. And I don't mean these bureaucrats. You got to have the bureaucrats. But I'm talking about people that's been out here practicing medicine on the front line.
Mr. Congressman, recently Ted Turner was being interviewed on television, and the issue was health care. And Ted said that he thinks the health care system in this country is broken, and it should be fixed. So the interview, I think it was whatever the interviewer's name was on NBC, said, well, you just gave away $1 billion. He said, that's true. And I'm prepared to lead the charge in fixing health care in this country. But it has to be taken seriously. So what Dr. Folk was talking about taking it seriously and putting together a team of people to look at fixing the health care issues, there are numerous issues. Now, as health care pertains to the minority community, there are several initiatives that are taking place, that are ongoing, that are working towards leveling the playing field in the area of disparities in the minority and underserved communities. And I think most of them or all of them are to be commended. Where I think the problem with them is that the information that's exchanged between those various initiatives, it should be consolidated. Like the government is starting to do in some other areas, consolidate the information source and get it out there. Now, I understand that the Congressional Black Caucus is looking at some ways of making some recommendations. Mm-hmm. They have several organizations that they've identified who may be able to impact to some degree what is happening in the area of this disparity. So I think that greater information dissemination, programs like the one that you have us here doing today that raise the issue, and at the end, if people are told what they can do, contact their representatives and state their position. Or you know, in the case of Dr. Folk, who's right in the center of Kings County and practiced for a long time, get in touch with him. You know, it may be hard to get through to him, but it still is worth the wait. Mm-hmm.